Professor, Physician, Epidemiologist. I am Dr. Sri Banerjee. Hello everyone, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this video, I'm going to be focusing on a very important public health topic which is overlooked, which is often overlooked, and that is the condition of anemia. Now, this may initially seem like a very specific type of condition. You might have heard it in conjunction with something like sickle cell disease. However, I would say that this is a problem that actually affects a lot more of the population. Anemia is typically something that you see in the clinic along with chronic diseases. Any sort of chronic diseases um, leads you to. So if you're in the clinic and you're seeing a patient in the hospital, you track their hemoglobin and you see it drop into like around 8 or so, and then you know you have to infuse maybe a unit of blood to try to make sure that that stays up. So, why is anemia so important? So, medically, you know that anemia is important because, of course, that is the way that your cells within your body is getting the oxygen. We can ensure that your body is getting the oxygen, and so oxygen leads to energy that your body needs. So there may be multiple etiology, of course. I'm looking at the abstract right now, and of course they go into using a WHO criteria to describe the public health severity of anemia based on population prevalences. So one way is that using aggregated results from the Global Burden of Disease 2016. And again, Global Burden of Disease, I've lectured on it elsewhere. Very, very, very useful resource if you're looking at any sort of chronic disorder at a global health level. So we compare the population prevalence of anemia. So they compared population prevalence of anemia with years lived with disability estimates. And so this gave them a nice sense of how mild, moderate, and severe anemia relates to disability. So it is a global kind of measure. And it was really interesting. So they start by defining anemia, which is, of course, a condition in which the number of red blood cells or their oxygen carrying capacity is insufficient to meet physiologic requirements. So this is, of course, very important. But whom does it affect? That is also important. So remember, PICO, we're always talking about or thinking of the patient population. So the patient population actually varies. So in children, anemia can actually manifest in reduced attention spans. So one major condition that you do see anemia associated with is lead. And of course, diminished work productivity is something else that is seen. Now, anemia is the most common blood disorder in the world, and it actually disproportionately affects children under 5 and women of reproductive age, so that pertaining in the ages 15 to 49 years of age. So this is all in low income settings. So definitely very much a global health topic as well, but anemia, when you're thinking about chronic diseases, is I would say a combination of global health and just thinking about health in the United States. But if you want more information of global burden of disease, I encourage you to go to that Global Health Disease Exchange and the website that has been provided for you right here. So, you know, if you look at the public health severity of anemia, this is based on population prevalence of low hemoglobin. So this is a World Health Organization classification of anemia. So at-risk population groups, so women or children, risk population groups, women or children with prevalence ranges of less than 4.9%, 5 to 20%, 20 to 40%, or greater than or equal to 40%, are classified. So the ranges are normal to mild, moderate, and then severe public health burden. That's how you classify it. Now, there's some etiologic indicators of anemia, that anemia is actually taking place, and one of those is C-reactive protein, which is really interesting, but also inflammatory markers like alpha-1 acid glycoprotein. So here's all the differences in hemoglobin concentrations for categorizing anemia. And as you can see, WHO recommendations are not always the same as GBD criteria. And then this shows kind of where anemia is. So what am I trying to say here? Well, it may be a good idea for you to, in some way, take anemia into consideration. In fact, when I was considering my study, I did consider taking anemia, but it didn't. It was beyond my scope, so I actually wasn't able to. But anemia is actually, during chronic disease, anemia is a very serious consideration and actually might make the difference between good health and poor health. So this actually goes into a little bit more detail about specific conditions of anemia, and I'm just making sure that covering everything here. So the data that was used, I want to make sure I'm clear on that. It's the biomarkers reflecting inflammation and nutritional determinants of anemia. So this has merged nationally and regionally represented nutrition data, a survey from multiple countries. So this one, I mean, if you're looking for something like this, I think this is a good data set to look for. And iron deficiency anemia would be a good marker to study. But again, global burden of disease, wonderful place for data. I have personally analyzed data from there, so that's what I'm telling you. But all of these places, it's a good thing to study the topic area of anemia because it's so broad, and everywhere from congestive heart failure to any sort of chronic disease, diabetes, everything, malaria, everything is connected to anemia. So I hope this has given you some insight as to how to grasp and how to study not only anemia but years living with disability, since sometimes some of those measures can be difficult to try to discern. I'm just trying to scan through this document to make sure that I'm not missing anything additionally that should have been included with anemia. So that wraps it up. We need to pay attention to the hemoglobin if you're a clinician. On a public health level, more studies need to be done as to see what the real effect of anemia is in some of our top chronic cardiovascular, respiratory, kidney diseases. Thank you for listening.